Question 1. Governance review demonstrates a consistent pattern of suboptimal outcomes in diabetic patients presenting with foot ulcers. A recent audit of a specific case highlights a patient with a Wagner grade 2 plantar ulcer, a history of poorly controlled diabetes, HbA1c 5%, and peripheral neuropathy. The patient also exhibits diminished pedal pulses. The current management plan involves daily saline moistened gauze dressing changes and advice to keep weight off it. Based on established certified wound care nurse competencies and regulatory guidelines for managing diabetic foot complications, which of the following represents the most appropriate and comprehensive initial management strategy? Option A. Refer the patient to a podiatrist for immediate surgical debridement and prescribe a broad-spectrum antibiotic without further wound assessment, assuming infection is present. Option B. Continue with daily saline moistened gauze dressing changes, reinforce the importance of keeping weight off the foot, and schedule a follow-up appointment in 2 weeks to reassess the wound. Option C. Focus solely on aggressive topical antimicrobial therapy to prevent infection, while advising the patient to elevate the affected limb and avoid any pressure. Option D. Implement a comprehensive offloading strategy, obtain a vascular assessment, optimize glycemic control in collaboration with the patient's primary care provider, and initiate appropriate debridement and infection control measures based on wound assessment. Correct answer is D. Implement a comprehensive offloading strategy, obtain a vascular assessment, optimize glycemic control in collaboration with the patient's primary care provider, and initiate appropriate debridement and infection control measures based on wound assessment. Explanation. This scenario presents a common yet critical challenge in wound care, managing a diabetic foot ulcer while adhering to established protocols and ensuring patient safety. The professional challenge lies in balancing the immediate need for effective wound management with the long-term goal of preventing recurrence and complications, all within the framework of evidence-based practice and regulatory compliance. The patient's history of diabetes and peripheral neuropathy significantly increases their risk for poor healing and infection, necessitating a meticulous and systematic approach. The correct approach represents best professional practice because it directly addresses the multifaceted needs of a diabetic patient with a foot ulcer. It prioritizes a comprehensive assessment that includes vascular status, neurological function, and nutritional factors, which are all critical determinants of healing in this population. The protocol's emphasis on offloading, appropriate debridement, infection control, and patient education aligns with current evidence-based guidelines for diabetic foot ulcer management. This holistic approach aims to not only heal the current wound, but also to empower the patient to prevent future issues, thereby reducing the risk of amputation and improving quality of life. This aligns with the ethical imperative to provide patient-centered care and uphold professional standards of practice as outlined by nursing regulatory bodies. Each incorrect approach represents specific regulatory or ethical failures. An approach that focuses solely on topical treatment, without addressing underlying systemic issues like glycemic control or vascular compromise, fails to meet the standard of comprehensive care. This can be considered a deviation from best practice and potentially a violation of the Nurse Practice Act, which mandates competent and evidence-based care. Neglecting to assess for or manage infection appropriately is a critical failure, potentially leading to sepsis and other life-threatening complications, which constitutes a breach of the nurse's duty of care and could have legal ramifications. Furthermore, failing to involve the patient in their care plan through education and shared decision-making undermines patient autonomy and can lead to non-adherence, ultimately compromising treatment outcomes. This also contravenes ethical principles of informed consent and patient empowerment. The professional decision-making process for similar situations should involve a systematic, evidence-based approach. First, conduct a thorough patient assessment, identifying all contributing factors to the wound and the patient's overall health status. Second, consult relevant clinical guidelines and protocols for diabetic foot ulcer management. Third, develop a multidisciplinary care plan that addresses all identified needs, including wound care, glycemic control, vascular assessment, and patient education. Fourth, implement the care plan, continuously monitoring the patient's progress and making adjustments as necessary. Finally, document all assessments, interventions, and patient responses meticulously. This process ensures that care is safe, effective, and compliant with professional and regulatory standards. Question 2. System analysis indicates that a certified wound care nurse is evaluating a pressure injury on a patient's sacrum. The wound bed is pink with visible granulation tissue, and there is moderate serous exudate. The surrounding skin is intact but shows early signs of maceration due to the current dressing. The nurse has access to a variety of advanced wound care dressings. Which of the following dressing selections would be most appropriate to manage the exudate? Promote healing and protect the peri-wound skin. Option A, a dry sterile gauze dressing. Option B, a hydrogel dressing. Option C, an alginate dressing. Option D, a transparent film dressing. Correct answer is C, an alginate dressing. Explanation: scenario analysis. This scenario presents a common clinical challenge where a certified wound care nurse must select the most appropriate dressing for a complex wound. The challenge lies in balancing patient needs, wound characteristics, and the availability of various advanced dressing types. Misjudgment can lead to delayed healing, increased patient discomfort, infection, and potential regulatory scrutiny. The nurse must demonstrate a thorough understanding of dressing properties and their indications, aligning with evidence-based practice and regulatory guidelines for wound management. Correct approach analysis. The correct approach involves a systematic assessment of the wound bed, exudate level, surrounding skin integrity, and the presence of infection. For a wound with moderate to heavy exudate and a need for autolytic debridement, an alginate dressing is indicated. Alginates are highly absorbent, forming a hydrophilic gel upon contact with wound fluid, which aids in autolytic debridement and maintains a moist wound environment conducive to healing. Their ability to absorb significant exudate prevents maceration of the surrounding skin. This selection aligns with best professional practice by prioritizing the specific physiological needs of the wound and promoting optimal healing conditions, thereby adhering to standards of care expected of a certified wound care nurse. Incorrect approach is analysis. Selecting a transparent film dressing for a wound with moderate to heavy exudate would be a regulatory and ethical failure. Transparent films are permeable to moisture vapor, but not to bacteria, making them suitable for superficial wounds with minimal exudate or for protecting intact skin. Their limited absorbency would lead to exudate pooling, maceration of peri-wound skin, and an increased risk of infection, contravening the nurse's duty to provide appropriate care and potentially violating facility policies and professional standards that mandate effective exudate management. Choosing a hydrogel dressing for a wound with moderate to heavy exudate is also inappropriate and represents a failure in professional judgment. Hydrogels are primarily indicated for dry to minimally exuding wounds, as they provide moisture to rehydrate dry tissue and promote autolytic debridement. In a wound with significant exudate, a hydrogel would not adequately manage the fluid, leading to the same complications of maceration and potential infection as a transparent film, thus failing to meet the wound's specific needs and potentially violating standards of care. Opting for a dry gauze dressing without a specific indication for its use, especially when advanced dressings are available and appropriate, could be considered a failure to utilize best available evidence and resources. While gauze has its place, for a wound with moderate to heavy exudate, it requires frequent changes to manage moisture, increasing the risk of trauma to the wound bed and peri-wound skin with each dressing change. This approach may not be considered the most effective or efficient use of nursing resources and could delay healing compared to a more advanced, absorbent dressing, potentially falling short of the expected standard of care for a certified wound care nurse. Professional reasoning. Professionals should employ a decision-making framework that begins with a comprehensive wound assessment. This includes evaluating the wound bed, granulation, slough, eschar, exudate characteristics, amount, color, odor, peri-wound skin condition, and any signs of infection. Following assessment, the nurse should consult evidence-based guidelines and product information for advanced wound care dressings. The selection process should prioritize dressings that address the primary needs of the wound, such as exudate management, debridement, moisture balance, and infection control. This systematic approach ensures that the chosen dressing is not only appropriate for the current wound state, but also supports the overall healing trajectory, aligning with regulatory expectations for competent and ethical practice. Question 3. Quality control measures reveal a wound assessment report that describes a wound bed with moderate erythema, warmth, and a serous exudate, accompanied by patient-reported pain. The nurse's documentation indicates the initiation of a collagen-based dressing to promote granulation, Which of the following nursing approaches best reflects adherence to the regulatory framework for wound care, considering the described wound characteristics? Option A. Continue with the collagen-based dressing, focusing on its ability to stimulate granulation tissue formation, as this is a key indicator of healing. Option B. Reevaluate the wound for signs of infection and consider interventions to manage inflammation and exudate, as these clinical indicators suggest the inflammatory phase is predominant. Option C. Transition to a silicone-based dressing to minimize trauma during dressing changes, assuming the wound is moving towards the remodeling phase. Option D. Increase the frequency of dressing changes to ensure optimal moisture balance, regardless of the specific healing phase. Correct answer is A. Continue with the collagen-based dressing, focusing on its ability to stimulate granulation tissue formation, as this is a key indicator of healing. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified wound care nurse, CWCN, to critically evaluate a patient's wound status against established best practices and regulatory expectations for wound care documentation and management. The challenge lies in accurately identifying the predominant phase of wound healing and ensuring that the nursing interventions are aligned with the physiological processes occurring in that phase. Misinterpreting the phase can lead to inappropriate treatment, delayed healing, and potential patient harm, which carries significant regulatory and ethical implications. Correct approach analysis. The correct approach involves a thorough assessment of the wound's clinical presentation, including visual inspection of exudate, tissue type, wound bed appearance, and surrounding skin condition, to determine the most active phase of healing. This aligns with the regulatory framework for nursing practice, which mandates evidence-based care and accurate documentation. For example, if the wound bed is characterized by significant erythema, edema, warmth, pain, and serous or purulent exudate, the inflammatory phase is likely predominant. Interventions should focus on managing inflammation, preventing infection, and preparing the wound bed for subsequent healing phases. This approach upholds the professional standard of care and ensures that patient care is guided by scientific principles and regulatory requirements for safe and effective practice. Incorrect approach is analysis. An approach that focuses solely on the presence of granulation tissue without considering other indicators of inflammation or the overall wound environment is incorrect. This fails to acknowledge that granulation tissue can be present in both the inflammatory and proliferative phases, and its presence alone does not negate the need to address ongoing inflammation or potential infection. This oversight could lead to premature cessation of anti-inflammatory measures or infection control, violating the regulatory expectation for comprehensive wound assessment and management. An approach that prioritizes the application of advanced dressings solely based on the wound's depth, without a clear understanding of the predominant healing phase, is also incorrect. While dressing selection is crucial, it must be tailored to the specific physiological needs of the wound at that moment. For instance, applying a highly absorptive dressing to a wound with minimal exudate, or a dressing that promotes excessive moisture to a wound in the inflammatory phase with significant edema, could impede healing and potentially exacerbate inflammation or maceration. This deviates from the regulatory requirement for evidence-based practice and individualized patient care. An approach that assumes wound healing progresses linearly and focuses only on the final stages of remodeling, overlooking the critical earlier phases, is fundamentally flawed. This neglects the essential biological processes that must occur sequentially for successful wound closure. Ignoring the inflammatory and proliferative phases can lead to missed opportunities for intervention, such as infection control or the promotion of new tissue formation, ultimately compromising the patient's outcome and potentially violating standards of care that require diligent monitoring and management throughout all healing stages. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive wound assessment. This involves gathering subjective and objective data, including patient history, pain assessment, and a detailed visual and tactile examination of the wound. The CWCN should then correlate these findings with the known characteristics of each wound healing phase: hemostasis, initial clot formation; inflammation, cleansing and preparation; proliferation, tissue regeneration and angiogenesis; and remodeling, tissue maturation and scar formation. Interventions should be selected based on the predominant phase identified and the patient's overall condition, with ongoing reassessment to monitor progress and adjust the plan of care as needed. This iterative process ensures that care remains aligned with physiological needs and regulatory expectations for quality patient outcomes. Question 4. System analysis indicates a certified wound care nurse is caring for a patient with a stage Roman III pressure injury who has consistently refused the prescribed negative pressure wound therapy, NPWT, due to discomfort experienced during previous applications. The nurse has assessed the wound, confirmed the NPWT is indicated according to current evidence-based guidelines, and has a prescription from the physician. The patient expresses a desire for the wound to heal, but is adamant about not having NPWT applied again. What is the most appropriate immediate nursing action? Option A. Reassess the patient's understanding of the benefits and risks of NPWT, explore the specific nature of their discomfort, and collaboratively discuss alternative strategies or modifications to the NPWT application to improve tolerance, while documenting all interactions and the patient's decision. Option B. Inform the patient that NPWT is the only effective treatment and that refusal will lead to poor outcomes, then proceed with application as ordered by the physician. Option C. Document the patient's refusal of NPWT and proceed with the prescribed moist wound healing regimen using standard dressings, as the patient's comfort is paramount. Option D. Contact the physician to request an alternative treatment that does not involve any form of wound therapy, as the patient has clearly stated their preference. The correct answer is A. Reassess the patient's understanding of the benefits and risks of NPWT, explore the specific nature of their discomfort, and collaboratively discuss alternative strategies or modifications to the NPWT application to improve tolerance, while documenting all interactions and the patient's decision. Explanation. Scenario analysis. This scenario presents a common implementation challenge in wound care, balancing patient autonomy and the nurse's professional judgment when a patient refuses a prescribed treatment. The challenge lies in respecting the patient's right to self-determination while ensuring they receive evidence-based care that promotes healing and prevents complications, all within the scope of professional nursing practice and regulatory guidelines. The nurse must navigate potential conflicts between patient wishes and optimal clinical outcomes. Correct approach analysis. The correct approach involves a thorough assessment of the patient's understanding of their condition and the proposed treatment, exploring the reasons for their refusal, and then re-educating them on the benefits and risks. This aligns with the ethical principles of beneficence, acting in the patient's best interest and autonomy, respecting the patient's right to make decisions about their own care. It also adheres to professional nursing standards that mandate clear communication, patient education, and collaborative decision-making. Documenting this entire process, including the patient's refusal and the nurse's interventions, is crucial for legal and professional accountability. Incorrect approaches analysis. One incorrect approach is to simply document the refusal and proceed with alternative, less effective care without further investigation or education. This fails to uphold the principle of beneficence, as it may lead to suboptimal healing or increased risk of complications. It also neglects the professional responsibility to advocate for the patient's well-being and to ensure they are making informed decisions. Another incorrect approach is to override the patient's refusal and administer the treatment forcefully or through coercion. This is a direct violation of patient autonomy and could constitute battery. It erodes the trust essential in the nurse-patient relationship and is ethically and legally indefensible. A third incorrect approach is to dismiss the patient's concerns as unfounded without attempting to understand their perspective or provide adequate information. This demonstrates a lack of empathy and professional engagement, failing to meet the standard of care that requires a patient-centered approach and thorough patient education. Professional reasoning. Professionals should employ a structured decision-making process that prioritizes patient safety and rights. This involves 1. Active listening to understand the patient's concerns and rationale for refusal. 2. Comprehensive assessment of the wound and the patient's overall health status. 3. Clear, jargon-free education about the prescribed treatment, its benefits, potential risks, and alternatives. 4. Collaborative discussion to explore options and address barriers to adherence. 5. Respectful documentation of the entire interaction and the final decision. If the patient continues to refuse a critical treatment, escalation to a physician or interdisciplinary team for further consultation and management is warranted. Question 5. Cost-benefit analysis shows that while surgical debridement offers rapid removal of necrotic tissue, it carries higher risks and costs. Considering a patient with a shallow superficial wound exhibiting moderate slough and a history of poor healing, which debridement method, when evaluated against regulatory guidelines for wound care, best balances efficacy, patient tolerance, and resource utilization? Option A. Enzymatic debridement using a broad-spectrum collagenase ointment applied liberally. Option B. Mechanical debridement with a wet-to-dry saline dressing applied and removed every 8 hours. Option C. Surgical debridement performed by a physician in an outpatient surgical center. Option D. Autolytic debridement using an appropriate occlusive dressing to promote the body's natural enzymes. The correct answer is D. Autolytic debridement using an appropriate occlusive dressing to promote the body's natural enzymes. Explanation. This scenario presents a common challenge in wound care, selecting the most appropriate debridement method when multiple options are available, each with distinct benefits and drawbacks. The professional challenge lies in balancing efficacy, patient comfort, cost-effectiveness, and adherence to evidence-based practice and regulatory guidelines. Careful judgment is required to avoid unnecessary patient harm or suboptimal outcomes. The correct approach represents best professional practice because it prioritizes patient safety and clinical effectiveness while considering resource utilization. Autolytic debridement, when appropriate, leverages the body's own mechanisms to break down necrotic tissue, is generally well tolerated, and can be cost-effective by minimizing the need for specialized personnel or equipment. This aligns with regulatory frameworks that emphasize patient-centered care and the use of least invasive effective interventions. An incorrect approach would be to solely focus on the speed of debridement without considering patient factors or potential complications. For example, choosing surgical debridement for a wound with minimal necrotic tissue and a patient who is a poor surgical candidate would be a regulatory and ethical failure. This could lead to increased pain, risk of infection, and higher healthcare costs, violating principles of beneficence and non-maleficence. Similarly, relying exclusively on enzymatic debridement without proper assessment of the wound bed and surrounding skin could lead to maceration or irritation, representing a failure to adhere to best practices and potentially violating guidelines on appropriate product selection and application. Mechanical debridement, if performed aggressively or with inappropriate agents, could cause trauma to the healthy granulation tissue, hindering healing and contravening principles of wound bed preparation. Professional decision-making in such situations requires a systematic approach. 1. Thorough wound assessment, including the type and amount of necrotic tissue, wound depth, surrounding skin condition, patient's overall health status and pain level. 2. Consideration of the available debridement modalities and their specific indications, contraindications, and potential risks and benefits. 3. Consultation with relevant guidelines and evidence-based literature. 4. Patient and family education and shared decision-making. 5. Ongoing monitoring of the wound response to the chosen intervention and adjustment as needed. Question 6. The audit findings indicate a discrepancy between your recent assessment of a patient's wound bed tissue type, exudate, odor, and signs of infection, and the documentation from a colleague's previous assessment. What is the most appropriate professional action to take in this situation? Option A. Discuss the discrepancy with other members of the healthcare team to seek their opinion before approaching your colleague. Option B. Initiate a private conversation with your colleague to review the wound assessment together, compare findings, and discuss any differences in interpretation to ensure the most accurate assessment informs the patient's care plan. Option C. Immediately document your assessment and implement a new treatment plan based on your findings, without discussing the discrepancy with your colleague. Option D. Document the discrepancy in the patient's chart, without discussing it directly with your colleague. Correct answer is B. Initiate a private conversation with your colleague to review the wound assessment together, compare findings, and discuss any differences in interpretation to ensure the most accurate assessment informs the patient's care plan. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a discrepancy in wound assessment documentation, potentially impacting patient care continuity and quality. The certified wound care nurse, CWCN, is faced with a situation where their assessment of wound bed tissue type, exudate, odor, and signs of infection differs from a colleague's previous documentation. This divergence requires careful judgment to ensure accurate diagnosis, appropriate treatment planning, and adherence to professional standards of care, all while maintaining interprofessional collegiality. The ethical dilemma lies in how to address this discrepancy without undermining a colleague's competence or compromising patient safety. Correct approach analysis. The correct approach involves a direct, professional, and collaborative discussion with the colleague. This aligns with best professional practice by prioritizing patient well-being through accurate assessment and treatment. It upholds ethical principles of honesty, integrity, and respect for colleagues. Specifically, the CWCN should initiate a private conversation to review the wound assessment together, compare findings, and discuss any differences in interpretation. This collaborative review ensures that the most accurate and up-to-date assessment informs the patient's care plan, adhering to the ethical obligation to provide competent and evidence-based care. This approach also fosters a culture of continuous learning and quality improvement within the healthcare team, which is implicitly supported by professional nursing standards that emphasize accurate documentation and communication. Incorrect approach is analysis. One incorrect approach is to immediately override the colleague's documentation and implement a new treatment plan without discussion. This is professionally unacceptable as it bypasses essential communication channels, potentially creating conflict and undermining team trust. It fails to acknowledge the possibility of a misinterpretation on the CWCN part or a valid reason for the previous assessment. Ethically, it violates the principle of respect for colleagues and can lead to a breakdown in collaborative care, ultimately jeopardizing patient safety if the initial assessment was indeed correct. Another incorrect approach is to document the discrepancy without discussing it with the colleague. This is professionally inadequate because it fails to resolve the differing assessments and leaves the patient's care plan in a state of ambiguity. It also misses an opportunity for professional development and peer learning. Ethically, it can be seen as a failure to act with due diligence in ensuring the most accurate care for the patient, and can be perceived as passive-aggressive or avoidant behavior, hindering effective team functioning. A third incorrect approach is to discuss the discrepancy with other team members without first speaking to the colleague involved. This is professionally inappropriate as it constitutes gossip or unprofessional communication, violating principles of collegiality and respect. It can damage professional relationships and create a negative work environment. Ethically, it breaches confidentiality regarding professional performance and can lead to a lack of trust within the team, hindering open communication and problem-solving. Professional reasoning. Professionals should approach such discrepancies by first assuming good intent and seeking clarification. The decision-making process should involve 1. Direct, private communication with the colleague to review the assessment together. 2. Collaborative interpretation of findings, referencing established wound assessment guidelines and evidence-based practice. 3. Reaching a consensus on the most accurate assessment to guide the care plan. 4. Documenting the agreed-upon assessment and the rationale for any changes. This systematic approach ensures patient safety, promotes professional growth, and maintains a positive and effective interprofessional working relationship. Question 7. Stakeholder feedback indicates that some nurses are inconsistently documenting the assessment of the skin surrounding chronic wounds. Specifically, there are concerns about the level of detail and objectivity in describing the color, temperature, and integrity of the peri-wound area. As a certified wound care nurse, what is the most appropriate approach to address this implementation challenge and ensure adherence to best practices and regulatory expectations for wound assessment? Option A. Update the facility's policy to state that peri-wound skin assessment is a component of wound care, but remove specific requirements for documenting color, temperature, and integrity to reduce documentation burden. Option B. Implement a standardized peri-wound assessment tool that requires specific descriptors for color, e.g., erythema, cyanosis, pallor, temperature, e.g., warm, cool, hot to touch, and integrity, e.g., intact, macerated, excoriated, indurated, with clear guidelines for its use and integration into the electronic health record. Option C. Encourage nurses to use their best judgment and document findings as they deem relevant, trusting their clinical experience to capture essential information about the peri-wound skin. Option D. Provide a brief in-service session reminding staff of the importance of observing the skin around wounds without introducing new documentation requirements, assuming existing protocols are sufficient. The correct answer is B. Implement a standardized peri-wound assessment tool that requires specific descriptors for color, e.g., erythema, cyanosis, pallor, temperature e.g., warm, cool, hot to touch, and integrity e.g., intact, macerated, excoriated, indurated, with clear guidelines for its use and integration into the electronic health record. Explanation. This scenario presents a common implementation challenge in wound care, ensuring consistent and accurate assessment of the skin surrounding a wound, which is crucial for early detection of complications and effective treatment planning. The challenge lies in the subjective nature of visual and tactile assessment, and the need for standardized documentation to facilitate communication among the healthcare team and ensure continuity of care. Adherence to the Certified Wound Care Nurse (CWCN) scope of practice and relevant nursing standards of practice is paramount. Correct approach represents best professional practice because it prioritizes a systematic, objective, and documented assessment of the peri-wound skin. This aligns with the CWCN responsibility to provide evidence-based care and maintain accurate patient records, as mandated by Nursing Practice Acts and professional guidelines. Thoroughly documenting color, temperature, and integrity allows for the identification of subtle changes that may indicate infection, ischemia, or pressure injury development, enabling timely intervention and preventing adverse outcomes. This systematic approach ensures that all relevant aspects of the peri-wound environment are considered, contributing to a comprehensive understanding of the patient's condition. An incorrect approach that relies solely on a general observation without specific attention to color, temperature, and integrity fails to meet the standards of a comprehensive wound assessment. This could lead to missed early signs of deterioration, violating the ethical duty to provide competent care and potentially breaching professional standards of practice. Another incorrect approach that involves documenting findings without specific descriptors, e.g., skin looks okay, lacks the objectivity and detail required for effective communication and care planning. This vagueness can lead to misinterpretations by other healthcare providers and hinder the tracking of wound progression or regression, thus failing to uphold the principles of accurate record keeping. An approach that delegates the detailed assessment of peri-wound skin to an unlicensed assistive personnel without direct supervision or a clear protocol for reporting findings may also be problematic. While delegation is a part of nursing practice, the ultimate responsibility for the accuracy and completeness of the patient's assessment rests with the licensed nurse, and failure to ensure proper oversight could lead to compromised patient care and regulatory noncompliance. Professional decision-making in such situations requires a systematic process. First, identify the core components of the required assessment: color, temperature, integrity of peri-wound skin. Second, consider the available tools and techniques for objective measurement or standardized description. Third, evaluate the importance of accurate and detailed documentation for communication and legal/ethical accountability. Finally, select the approach that best ensures patient safety, promotes effective care, and adheres to professional standards and regulatory requirements. Question 8. The control framework reveals that a certified wound care nurse is assessing a patient's lower extremity wound. The wound presents with a pale, non-viable tissue layer covering approximately 50% of the wound bed, with moderate serous exudate and intact peri-wound skin. The patient reports the wound developed after a minor fall. Based on the CWCN scope of practice and established wound classification principles, which of the following best describes the initial classification of this wound? Option A. A full-thickness wound with eschar necessitating immediate surgical intervention. Option B. A superficial wound with granulation tissue indicating early healing. Option C. A partial thickness wound with slough requiring debridement and moisture-retentive dressing. Option D. A partial thickness wound with fibrin suggesting a need for enzymatic debridement. The correct answer is C. A partial thickness wound with slough requiring debridement and moisture-retentive dressing. Explanation. The control framework reveals that accurate wound classification is paramount for effective patient care and adherence to regulatory standards within the Certified Wound Care Nurse (CWCN) scope of practice. Misclassification can lead to inappropriate treatment plans, delayed healing, increased risk of infection, and potential non-compliance with documentation requirements. This scenario is professionally challenging because it requires the nurse to integrate theoretical knowledge of wound types with practical assessment skills, considering multiple factors that can influence a wound's presentation and classification. The correct approach represents best professional practice because it systematically evaluates the wound based on established CWCN competencies and regulatory guidelines. This involves a comprehensive assessment of the wound's etiology, depth, exudate, tissue type, and surrounding skin integrity. Adhering to these established classification systems ensures that treatment is evidence-based, patient-centered, and aligns with the standards of care expected of a CWCN. This methodical approach minimizes the risk of diagnostic error and promotes optimal patient outcomes, fulfilling the ethical obligation to provide competent and safe care. An incorrect approach that relies solely on the visual appearance of the wound, without considering its underlying cause, fails to meet the comprehensive assessment requirements mandated by CWCN standards. This oversight can lead to misdiagnosis and inappropriate interventions, potentially exacerbating the wound's condition and violating the principle of beneficence. Another incorrect approach that prioritizes a single characteristic, such as the presence of slough, over a holistic assessment, neglects the complex interplay of factors contributing to wound status. This narrow focus can result in a superficial understanding of the wound, leading to ineffective treatment strategies and a failure to address the root cause of the wound's progression, thereby contravening the CWCN responsibility for thorough evaluation. The professional reasoning process for similar situations should involve a structured assessment protocol. This includes 1. Identifying the primary etiology of the wound, e.g., pressure, vascular insufficiency, trauma. 2. Assessing wound characteristics, depth, dimensions, presence of undermining or tunneling. 3. Evaluating wound bed characteristics, granulation, slough, eschar, necrosis. 4. Quantifying exudate amount, type, odor. 5. Examining the periwound skin. And 6. Considering patient-specific factors, comorbidities, nutritional status, mobility. This comprehensive approach ensures that the classification is accurate and informs a targeted, evidence-based treatment plan, aligning with regulatory expectations for skilled wound care. Question 9. Quality control measures reveal a pattern of inconsistent wound etiology identification among nursing staff. A certified wound care nurse is tasked with developing an educational module to address this. Considering the common wound types encountered in practice, which of the following assessment strategies best exemplifies a comprehensive and accurate approach to differentiating between surgical, traumatic, pressure, diabetic, venous, and arterial ulcers? Option A. Focusing on the patient's history of diabetes and the presence of neuropathy as the sole determinants for classifying any foot wound as a diabetic ulcer. Option B. Prioritizing the assessment of wound location and the presence of edema, as these are primary indicators for venous and pressure ulcers respectively. Option C. Conducting a thorough patient history, a detailed wound assessment including characteristics of the wound bed and periwound skin, and evaluating for signs of arterial and venous insufficiency, alongside considering the mechanism of injury for traumatic or surgical wounds. Option D. Assuming that any wound occurring over a bony prominence is a pressure ulcer, and initiating appropriate offloading and dressing protocols without further investigation into other potential etiologies. The correct answer is B. Prioritizing the assessment of wound location and the presence of edema, as these are primary indicators for venous and pressure ulcers respectively. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified wound care nurse, CWCN, to differentiate between multiple chronic wound etiologies based on subtle clinical presentations. Misclassification can lead to inappropriate treatment, delayed healing, increased patient suffering, and potential legal or regulatory repercussions for the healthcare facility and the nurse. The CWCN must apply a high level of critical thinking and diagnostic acumen, adhering strictly to established clinical guidelines and regulatory standards for wound assessment and management. The CWCN ensures that the treatment plan is targeted and effective, promoting optimal healing outcomes and patient safety, thereby meeting professional standards of care. Incorrect approaches analysis. One incorrect approach involves solely relying on the presence of exudate to diagnose a venous ulcer. This is a failure to conduct a thorough assessment, as exudate is common in many wound types and not pathognomonic for venous insufficiency. This oversight could lead to misdiagnosis and the application of incorrect compression therapy, potentially exacerbating the condition or delaying appropriate treatment for the actual underlying cause, violating professional standards of diagnostic accuracy. Another incorrect approach is to assume a wound on the foot of a diabetic patient is automatically a diabetic ulcer without further investigation. While diabetes is a significant risk factor for foot ulcers, other etiologies like pressure, trauma, or arterial insufficiency can also cause foot wounds. This assumption bypasses crucial assessment steps, such as evaluating pedal pulses, skin perfusion, and pressure points, leading to a potentially incorrect diagnosis and ineffective treatment plan, which is a failure to adhere to comprehensive wound assessment protocols. A further incorrect approach is to treat any superficial, non-healing wound as a pressure ulcer without considering other factors. Pressure ulcers have specific characteristics related to pressure, shear, and friction, often occurring over bony prominences. Failing to assess for signs of arterial or venous insufficiency or traumatic injury and solely attributing the wound to pressure is a diagnostic error that can result in inappropriate interventions and failure to address the true underlying pathology, contravening best practices in wound etiology determination. Professional reasoning. Professionals should employ a systematic, evidence-based approach to wound assessment. This involves 1. Obtaining a detailed patient history including comorbidities, previous wounds, and current treatments. 2. Performing a thorough physical examination of the wound and surrounding skin, noting size, depth, tissue type, exudate, odor, and periwound condition. 3. Assessing for signs of specific etiologies such as arterial insufficiency, e.g., diminished pulses, dependent rubor, pallor on elevation, venous insufficiency, e.g., edema, hemosiderin staining, varicosities, pressure, e.g., location over bony prominences, and diabetes, e.g., neuropathy, peripheral artery disease. 4. Considering diagnostic tests as indicated, e.g., ABI, Doppler studies, cultures. And 5. Integrating all findings to arrive at an accurate diagnosis and develop an individualized, evidence-based treatment plan. This structured decision-making process ensures that all relevant factors are considered, leading to optimal patient outcomes and adherence to professional and regulatory standards. Question 10. Assessment of a sacral pressure injury reveals a wound bed with 30% slough, moderate serous exudate, and surrounding skin exhibiting early signs of maceration. The patient is bedbound. Which dressing selection best addresses these combined wound characteristics and promotes optimal healing? Option A, a hydrocolloid dressing with moderate absorption capacity. Option B, a simple dry gauze dressing. Option C, a silicone foam dressing. Option D, an alginate dressing. Correct answer is A, a hydrocolloid dressing with moderate absorption capacity. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a wound exhibits multiple characteristics, requiring the nurse to prioritize dressing selection based on the most critical indications and contraindications. The presence of moderate exudate, slough, and a risk of maceration necessitates a careful balance between absorption, debridement support, and moisture management. Failure to select the appropriate dressing can impede healing, increase the risk of infection, and cause patient discomfort. Correct approach analysis. Selecting a hydrocolloid dressing with a moderate absorption capacity is the best professional practice in this situation. Hydrocolloids are indicated for wounds with moderate exudate and can provide a moist wound healing environment, which is conducive to autolytic debridement of slough. They also form a gel upon contact with exudate, creating a barrier that protects the periwound skin from maceration. This aligns with evidence-based wound care guidelines that advocate for moist wound healing and appropriate management of exudate and non-viable tissue. Incorrect approaches analysis. Choosing a simple dry gauze dressing would be a regulatory and ethical failure. Dry gauze does not provide a moist healing environment and can adhere to the slough, potentially causing trauma and pain during removal, hindering autolytic debridement. It also offers minimal protection against maceration if exudate is not managed effectively. Applying a silicone foam dressing without considering the slough would be a professional oversight. Silicone foam dressings are excellent for managing moderate to heavy exudate and protecting periwound skin. They are not designed to actively debride slough. Their primary function is absorption and exudate management, and their use without addressing the non-viable tissue could delay healing. Using an alginate dressing as the primary choice would also be suboptimal. Alginates are highly absorbent and are excellent for managing heavy exudate, but in this case, the exudate is described as moderate. While alginates can aid in autolytic debridement, their high absorbency might lead to excessive moisture if the exudate level is not consistently high, potentially increasing the risk of maceration if not managed with a secondary dressing. Furthermore, their use on a wound with significant slough might not be the most efficient primary debridement strategy compared to a dressing that supports autolysis more directly. Professional reasoning. Professionals should approach dressing selection by systematically evaluating wound characteristics, exudate level and type, presence of non-viable tissue, slough, eschar, wound bed condition, granulation, epithelialization, periwound skin integrity, and patient factors, pain, allergies, mobility. The goal is to select a dressing that addresses the most pressing needs of the wound while promoting an optimal healing environment. This involves understanding the indications and contraindications of various dressing categories and applying this knowledge within the scope of practice and relevant clinical guidelines. Question 11. Comparative studies suggest that while standardized protocols exist for wound dressing changes, the optimal frequency and technique are significantly influenced by individual wound characteristics and patient factors. A certified wound care nurse is assessing a patient with a chronic venous leg ulcer. The patient reports significant pain during dressing changes and expresses a desire for fewer interventions. The wound bed shows moderate exudate and is clean with no signs of infection. The nurse is considering the best approach to manage this patient's dressing changes. Which of the following approaches best reflects current evidence-based practice and professional nursing standards for this patient? Option A. Implement a dressing change schedule based on the specific dressing product's recommended wear time, while incorporating patient-reported pain levels into the technique to minimize discomfort during the change. Option B. Select the most advanced, high-absorbency dressing available and schedule changes based solely on the product's maximum wear time, without further patient or wound assessment. Option C. Prioritize the patient's expressed desire for less frequent dressing changes, performing them only when the dressing is visibly saturated or soiled to maximize patient comfort. Option D. Adhere to a fixed, daily dressing change schedule to ensure consistent monitoring and management of the wound, regardless of exudate levels or patient comfort. The correct answer is A. Implement a dressing change schedule based on the specific dressing product's recommended wear time, while incorporating patient-reported pain levels into the technique to minimize discomfort during the change. Explanation. This scenario is professionally challenging because it requires the certified wound care nurse, CWCN, to balance evidence-based practice, patient-specific needs, and regulatory compliance when determining dressing, change frequency, and technique. The CWCN must navigate potential conflicts between established protocols and individual patient responses, ensuring optimal wound healing while minimizing discomfort and risk of infection. The correct approach, which prioritizes a patient-centered, evidence-based assessment to determine dressing change frequency and technique, represents best professional practice. This aligns with the ethical obligation to provide individualized care and adhere to the principles of beneficence and non-maleficence. Regulatory frameworks for nursing practice, such as those governed by the American Nurses Association (ANA), Standards of Practice, and the Wound, Ostomy, and Continence Nurses Society, walk-in guidelines, emphasize the importance of ongoing assessment, critical thinking, and tailoring interventions to meet the unique needs of each patient. This approach ensures that dressing changes are performed only when necessary, reducing the risk of mechanical trauma to the wound bed, minimizing patient discomfort, and optimizing the use of resources. An incorrect approach that rigidly adheres to a fixed, universal dressing change schedule without considering wound characteristics or patient response fails to meet the standard of individualized care. This could lead to unnecessary interventions, increased patient pain, and potential disruption of the healing process, violating the principle of non-maleficence. Ethically, it demonstrates a lack of critical thinking and patient advocacy. Another incorrect approach that prioritizes solely patient preference for less frequent dressing changes, even when clinical indicators suggest otherwise, is also professionally unacceptable. While patient comfort is crucial, it must be balanced with clinical necessity. Ignoring signs of exudate, odor, or potential infection to accommodate a patient's preference could lead to delayed healing, increased risk of complications, and potential harm, contravening the nurse's duty to protect the patient's well-being. This approach could also be seen as a failure to uphold professional accountability for optimal patient outcomes. A further incorrect approach that focuses solely on the most advanced or expensive dressing materials without a clear clinical rationale for their use, and without considering the impact on dressing change frequency or patient comfort, is also problematic. While innovative products can be beneficial, Their selection should be guided by evidence of efficacy for the specific wound type and stage, and their impact on the overall care plan, including the frequency of interventions and patient experience. This approach may not be cost-effective and could lead to unnecessary interventions if not appropriately matched to the wound's needs. The professional decision-making process for similar situations should involve a systematic assessment of the wound, including type, stage, exudate, odor, surrounding skin, the patient's overall condition and preferences, and current evidence-based guidelines. The CWCN should then critically evaluate the rationale for specific dressing change frequencies and techniques, considering the potential benefits and risks to the patient. This involves a continuous cycle of assessment, planning, intervention, and evaluation, ensuring that care is dynamic and responsive to the patient's evolving needs. Question 12. Process analysis reveals that a certified wound care nurse is managing a patient with a moderately exuding, granulating wound with some superficial slough. The nurse needs to select the most appropriate cleansing solution and method to promote optimal healing while minimizing patient discomfort and preventing further tissue damage. Considering the wound characteristics and the need for evidence-based practice, which of the following represents the most appropriate approach? Option A. Apply a povidone iodine solution directly to the wound bed with a cotton swab to ensure thorough disinfection. Option B. Use a commercially available enzymatic debriding agent as the primary cleansing solution to break down the slough. Option C. Irrigate the wound with tap water at room temperature to remove debris and then gently wipe the wound with a clean cloth. Option D. Utilize a sterile saline solution with gentle irrigation using a 30 ml syringe and a 19-gauge blunt tip needle, followed by patting the wound dry with sterile gauze. Correct answer is D. Utilize a sterile saline solution with gentle irrigation using a 30 ml syringe and a 19-gauge blunt tip needle, followed by patting the wound dry with sterile gauze. Explanation. This scenario presents a common clinical challenge in wound care, selecting the most appropriate cleansing solution and method for a specific wound type, balancing efficacy with patient tolerance and adherence to established best practices. The challenge lies in the nuanced differences between various cleansing agents and techniques, and the need to individualize care based on wound characteristics, patient factors, and available resources, all while operating within the regulatory framework for certified wound care nurses. The correct approach prioritizes evidence-based practice and patient safety, aligning with the principles of professional nursing conduct and the standards of care expected of a certified wound care nurse. This involves a thorough assessment of the wound bed, exudate levels, presence of debris or slough, and patient comfort. The chosen solution and method should be effective in removing non-viable tissue and reducing microbial load without causing further tissue damage or irritation. Adherence to institutional policies and guidelines, which are typically informed by regulatory requirements and professional standards, is paramount. This approach ensures that patient outcomes are optimized and that the nurse is acting within their scope of practice and ethical obligations. Incorrect approaches fail to meet these standards. Using a harsh, non-specific antiseptic solution without considering its potential for cytotoxicity or patient sensitivity can lead to delayed healing and increased discomfort, violating the principle of do no harm. Employing a cleansing method that is too aggressive, such as vigorous scrubbing with a rough material, can cause mechanical trauma to fragile granulation tissue, hindering the healing process. Conversely, using an insufficient cleansing agent or method that fails to adequately remove debris or reduce bioburden can lead to infection or delayed healing, representing a failure to provide competent care. Relying solely on patient preference without clinical justification, or using outdated or unverified cleansing products, also constitutes a deviation from best practice and potentially regulatory noncompliance, as it may not align with current evidence-based guidelines or safety protocols. Professionals should employ a decision-making framework that begins with a comprehensive wound assessment. This assessment should guide the selection of a cleansing solution and method that is appropriate for the specific wound type, stage of healing, and patient condition. Consideration should be given to the solution's efficacy, safety profile, including potential for cytotoxicity, and ease of use. The method of application should be gentle yet effective. Furthermore, nurses must stay current with evidence-based guidelines and institutional protocols, consulting with wound care specialists or physicians when necessary. This systematic approach ensures that care is individualized, safe, and effective, upholding professional standards and regulatory expectations. Question 13. To address the challenge of a patient presenting with a surgical incision that has become increasingly red and warm to the touch over the past 24 hours, with a slight increase in serous drainage, what is the most appropriate initial nursing action to determine the presence and nature of a potential infection? Option A. Obtain a wound culture from the incision site. Option B. Document the findings and continue routine wound care. Option C. Increase the frequency of dressing changes to twice daily. Option D. Administer a broad-spectrum topical antibiotic ointment. The correct answer is A. Obtain a wound culture from the incision site. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in wound care, distinguishing between normal wound healing inflammatory responses and early signs of infection. Misinterpreting these signs can lead to delayed or inappropriate treatment, potentially resulting in increased patient morbidity, prolonged healing times, and the development of antibiotic resistance. The nurse must apply critical thinking skills, integrating clinical observation with knowledge of wound healing physiology and infection control principles. Correct approach analysis. The correct approach involves a comprehensive assessment of the wound and surrounding tissue, considering multiple clinical indicators beyond just redness or warmth. This aligns with the Certified Wound Care Nurse (CWCN) scope of practice, emphasizing evidence-based practice and patient safety. Specifically, it requires evaluating the presence of purulent exudate, increased pain, odor, delayed healing, and systemic signs of infection, fever, elevated white blood cell count. This holistic assessment guides the decision to obtain a wound culture, which is crucial for identifying the causative pathogen and guiding appropriate antibiotic therapy, as per established infection control guidelines for wound management. The decision to culture should be based on clinical suspicion of infection, not as a routine measure. Incorrect approach is analysis. Initiating broad-spectrum antibiotics solely based on localized redness and warmth without further assessment or evidence of infection is a significant regulatory and ethical failure. This practice contributes to antibiotic resistance, a major public health concern, and violates principles of judicious antibiotic stewardship, which are implicitly expected of all healthcare professionals, including CWCN. Furthermore, it bypasses the essential step of diagnostic culturing when infection is suspected, leading to potentially ineffective treatment and unnecessary exposure to medication side effects. Obtaining a wound culture from a clean, non-exudative wound without any signs or symptoms suggestive of infection is also an inappropriate use of resources and can lead to a false positive result or the identification of colonizing bacteria rather than a true pathogen. This deviates from best practices in diagnostic testing and infection control, as cultures should be targeted to confirm suspected infections. Ignoring signs of potential infection, such as increased exudate or odor, and continuing with routine dressing changes without further investigation or consultation represents a failure to adhere to the standard of care for wound management. This can lead to the progression of infection, patient harm, and a breach of professional responsibility to monitor and intervene appropriately. Professional reasoning. Professionals should employ a systematic approach to wound assessment, starting with a thorough visual inspection and palpation of the wound and periwound skin. This should be followed by an evaluation of exudate characteristics, amount, color, consistency, odor, pain levels, and the presence of any systemic signs of infection. If clinical indicators strongly suggest infection, the next step is to consider obtaining a wound culture to guide targeted antibiotic therapy, adhering to local institutional policies and evidence-based guidelines for wound infection management. This decision-making process prioritizes patient safety, effective treatment, and responsible antibiotic use. Question 14. Stakeholder feedback indicates a desire to expedite the healing of a complex, non-healing lower extremity wound. The interdisciplinary team is considering two advanced treatment modalities: negative pressure wound therapy, NPWT, and the application of a bioengineered skin substitute. Considering the certified wound care nurse's role in ensuring optimal patient outcomes and adherence to regulatory frameworks, which of the following approaches best guides the selection between these two advanced therapies? Option A. Recommend the therapy that the patient expresses a preference for, given their desire for expedited healing, and document this preference as the primary driver for selection. Option B. Prioritize the therapy that has demonstrated the most rapid initial reduction in wound size in published literature, assuming this correlates with overall faster healing. Option C. Select the therapy that is most readily available in the facility's inventory and has been used successfully on similar-looking wounds in the past. Option D. Conduct a comprehensive assessment of the wound's characteristics, the patient's overall health status and comorbidities, and consult current evidence-based guidelines to determine the most appropriate therapy for this specific patient. The correct answer is B. Prioritize the therapy that has demonstrated the most rapid initial reduction in wound size in published literature, assuming this correlates with overall faster healing. Explanation: scenario analysis. This scenario is professionally challenging because it requires the certified wound care nurse, CWCN, to critically evaluate the efficacy and appropriateness of two advanced wound care modalities: negative pressure wound therapy, NPWT, and bioengineered skin substitutes, for a complex wound. The challenge lies in discerning which therapy or combination aligns best with current evidence-based practice, patient-specific factors, and the regulatory landscape governing advanced wound care products and their reimbursement. The CWCN must navigate potential conflicts between stakeholder preferences, e.g., physician preference, patient desire for rapid healing, and the most clinically sound, cost-effective, and compliant treatment plan. Correct approach analysis. The correct approach emphasizes a comprehensive, evidence-based assessment that considers the wound's characteristics, the patient's overall condition, and the specific indications and contraindications for each advanced therapy. This aligns with the CWCN professional responsibility to provide safe, effective, and ethical care. It also implicitly adheres to regulatory guidelines that often require documentation of medical necessity, appropriate product selection based on clinical evidence, and adherence to payer policies for reimbursement of advanced therapies. By prioritizing a thorough evaluation and tailoring the treatment to the individual patient, the CWCN upholds professional standards and ensures optimal patient outcomes while remaining compliant with healthcare regulations. Incorrect approaches analysis. One incorrect approach might involve defaulting to a therapy based solely on physician preference or perceived ease of application, without a robust clinical justification. This could lead to the use of an inappropriate or less effective therapy, potentially violating professional standards of care and regulatory requirements for medical necessity. It also risks noncompliance with payer policies, leading to denied reimbursement. Another incorrect approach could be to select a therapy based on marketing claims or anecdotal evidence rather than peer-reviewed research and established clinical guidelines. This disregards the evidence-based practice mandate inherent in professional nursing and regulatory expectations for the use of advanced medical technologies. Such a choice could result in suboptimal patient outcomes and regulatory scrutiny. A third incorrect approach might be to overlook the patient's comorbidities or the wound-specific etiology when choosing between NPWT and bioengineered skin substitutes. Advanced therapies have specific indications and contraindications, and failing to consider these can lead to ineffective treatment, adverse events, and a failure to meet regulatory standards for appropriate use of medical devices and biologics. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough wound assessment, including dimensions, depth, exudate, tissue type, and signs of infection. This assessment should be followed by a review of the patient's medical history, comorbidities, nutritional status, and psychosocial factors. Next, the CWCN should consult current, evidence-based clinical practice guidelines and relevant literature pertaining to NPWT and bioengineered skin substitutes. The decision should then be made in collaboration with the interdisciplinary team, considering the specific indications, contraindications, expected outcomes, and potential risks and benefits of each modality for the individual patient. Finally, the chosen therapy must be documented thoroughly, justifying its medical necessity and alignment with payer requirements to ensure compliance and optimal patient care. Question 15. The control framework reveals that a certified wound care nurse is assessing a patient with a newly diagnosed diabetic foot ulcer. Which of the following management strategies best reflects a comprehensive and compliant approach to this patient's care, considering risk assessment, offloading, and the necessity of a multidisciplinary team? Option A. Focus solely on educating the patient about wound care at home and await further physician orders for any interventions, including offloading or specialist referrals. Option B. Conduct a thorough risk assessment to identify contributing factors, implement an appropriate offloading strategy based on the assessment, and initiate collaboration with the patient's physician, podiatrist, and other relevant healthcare professionals. Option C. Prescribe a removable cast walker for offloading without a formal risk assessment, assuming it is the most universally effective intervention for all diabetic foot ulcers. Option D. Prioritize aggressive debridement and application of advanced topical dressings, deferring offloading and multidisciplinary consultation until the wound shows signs of improvement. Correct answer is D. Prioritize aggressive debridement and application of advanced topical dressings, deferring offloading and multidisciplinary consultation until the wound shows signs of improvement. Explanation. Scenario analysis. Managing diabetic foot ulcers presents a significant professional challenge due to the complex interplay of physiological factors, patient adherence, and the potential for severe complications, including infection, osteomyelitis, and amputation. The nurse must navigate these complexities while adhering to established best practices and regulatory guidelines to ensure optimal patient outcomes. The risk of rapid deterioration necessitates prompt and accurate assessment, effective intervention, and ongoing monitoring. Correct approach analysis. The correct approach emphasizes a comprehensive, multidisciplinary strategy that integrates risk assessment, appropriate offloading, and collaborative care. This aligns with the certified wound care nurse scope of practice, which mandates a holistic approach to wound management. Regulatory frameworks, such as those guiding wound care practice in the U.S., e.g., Centers for Medicare and Medicaid Services guidelines for wound care reimbursement and quality indicators, and recommendations from professional organizations like the Association for the Advancement of Wound Care Professionals, underscore the importance of individualized care plans, evidence-based interventions, and interprofessional collaboration. A robust risk assessment identifies factors contributing to ulcer development and progression, guiding the selection of appropriate offloading techniques, e.g., total contact casts, removable cast walkers, therapeutic footwear, to reduce pressure and promote healing. The multidisciplinary approach, involving physicians, podiatrists, dietitians, and physical therapists, ensures that all aspects of the patient's health, including glycemic control, nutrition, and mobility, are addressed, which is ethically and regulatorily mandated for comprehensive patient care. Incorrect approach is analysis, focusing solely on topical wound treatments without addressing the underlying biomechanical forces. Offloading represents a significant regulatory and ethical failure. This approach neglects the fundamental principle of pressure reduction, which is critical for healing diabetic foot ulcers. Such a failure could be considered a deviation from accepted standards of care, potentially leading to prolonged healing times, increased risk of infection, and adverse patient outcomes, which could be subject to professional review and disciplinary action. Implementing an offloading strategy without a thorough risk assessment is also professionally unacceptable. Risk assessment is essential to tailor the offloading method to the individual patient's needs, considering factors like ulcer location, severity, patient mobility, and comorbidities. Without this, the chosen offloading method might be ineffective or even detrimental, leading to new pressure points or patient noncompliance. This oversight could be viewed as a breach of professional duty to provide individualized and evidence-based care. Relying exclusively on physician orders without independent nursing assessment and critical thinking is another failure. While collaboration is key, nurses have a distinct role in wound assessment, monitoring, and advocating for the patient. Delegating all decision-making to another discipline without active nursing participation undermines the nurse's expertise and the patient's comprehensive care. This can lead to missed opportunities for early intervention or adjustments to the care plan, potentially violating professional standards that expect nurses to exercise independent judgment within their scope of practice. Professional reasoning. Professionals should approach diabetic foot ulcer management by first conducting a comprehensive risk assessment, utilizing validated tools and clinical judgment to identify contributing factors. This assessment should inform the selection of appropriate, evidence-based interventions, with a strong emphasis on offloading techniques tailored to the individual patient. Simultaneously, initiating and maintaining communication with the multidisciplinary team is paramount to ensure coordinated and holistic care. Regular reassessment of the ulcer and the patient's overall condition is crucial for adjusting the treatment plan as needed, always documenting all interventions and outcomes meticulously. This systematic, patient-centered, and collaborative approach ensures adherence to regulatory requirements and ethical obligations for providing high-quality wound care. Question 16. Market research demonstrates that patients with chronic wounds often present with multiple interconnected factors that impede healing. A certified wound care nurse, CWCN, is assessing a 78-year-old male patient with a non-healing lower extremity ulcer. The patient has a history of type 2 diabetes, is taking prednisone for an autoimmune condition, and reports a poor appetite due to recent illness. Which of the following approaches best reflects a comprehensive strategy for optimizing this patient's wound healing? Option A. Primarily focus on selecting the most advanced topical dressing available to promote a moist wound environment. Option B. Implement a wound care plan that includes aggressive debridement and the application of a novel antimicrobial agent. Option C. Conduct a thorough assessment of the patient's nutritional status, glycemic control, and the impact of prednisone on his immune and inflammatory responses, and integrate these findings into the overall wound management plan. Option D. Advise the patient to increase his fluid intake and ensure regular dressing changes every 48 hours. The correct answer is A. Primarily focus on selecting the most advanced topical dressing available to promote a moist wound environment. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a nurse must synthesize multiple patient-specific factors to optimize wound healing. The complexity arises from the interplay of age-related physiological changes, nutritional status, the presence of chronic diseases, and the potential impact of prescribed medications, all of which can independently or synergistically impede healing. A failure to comprehensively assess and address these factors can lead to prolonged healing times, increased risk of complications such as infection, and diminished patient quality of life. Professional judgment is paramount in prioritizing interventions and tailoring the care plan to the individual's unique circumstances, adhering to evidence-based practice and regulatory standards for wound management. Correct approach analysis. The correct approach involves a holistic and individualized assessment of the patient's age, nutritional status, comorbidities, and current medications. This aligns with the Certified Wound Care Nurse, CWCN, scope of practice, which mandates a comprehensive evaluation to identify barriers to healing. For instance, advanced age can be associated with reduced cellular proliferation and immune response, while poor nutrition can lead to deficiencies in essential nutrients for tissue repair. Comorbidities like diabetes mellitus or peripheral vascular disease directly impair circulation and oxygenation, critical for healing. Medications, such as corticosteroids or immunosuppressants, can suppress the inflammatory response necessary for wound closure. By systematically evaluating each of these factors, the CWCN can develop a targeted and effective wound care plan that addresses the root causes of delayed healing, thereby promoting optimal outcomes and adhering to professional standards of care. This approach is ethically sound as it prioritizes patient well-being and is consistent with regulatory expectations for evidence-based, patient-centered care. Incorrect approaches analysis. Focusing solely on topical wound management without considering systemic factors represents a significant regulatory and ethical failure. This approach neglects the fundamental principle that wound healing is a complex physiological process influenced by the entire patient. For example, ignoring a patient's malnutrition while applying advanced dressings would be ineffective and potentially wasteful of resources, violating the ethical duty to provide appropriate and effective care. Similarly, overlooking the impact of a patient's diabetes on circulation and glycemic control, and only treating the wound surface, fails to address a primary barrier to healing and could lead to complications, contravening professional standards that require a comprehensive assessment. Prescribing or recommending interventions without considering potential drug interactions or contraindications related to the patient's existing medications is also a serious ethical lapse and a potential violation of practice guidelines, as it could harm the patient. Professional reasoning. Professionals should employ a systematic, patient-centered approach. This begins with a thorough history and physical examination, specifically probing for factors that influence wound healing. This includes detailed inquiries about diet, hydration, existing medical conditions, and a comprehensive review of all current medications, including over-the-counter drugs and supplements. The nurse should then correlate these findings with the wound assessment to identify specific barriers. Evidence-based guidelines and protocols for wound care should be consulted to inform the development of an individualized plan. Regular reassessment of the wound and the patient's overall condition is crucial to monitor progress and adjust the plan as needed. Collaboration with other healthcare professionals, such as physicians, dietitians, and pharmacists, is essential when complex comorbidities or polypharmacy are present. This integrated approach ensures that all contributing factors are addressed, leading to the best possible patient outcomes. Question 17. Consider a scenario where a nurse is managing a stage Roman III pressure injury with moderate to heavy exudate. The periwound skin is intact but shows early signs of maceration. The nurse needs to select a dressing that will effectively manage the exudate while promoting a moist wound healing environment and protecting the periwound skin. Which of the following dressing strategies best addresses this clinical situation? Option A. Simple dry gauze dressing to absorb excess moisture and allow the wound to air dry, promoting faster healing. Option B. A superabsorbent dressing designed to wick away and lock in large amounts of exudate, with a semi-permeable film as a secondary dressing to maintain a moist environment and protect from external contaminants. Option C. A hydrocolloid dressing to provide a moist environment and absorb minimal exudate with frequent dressing changes. Option D. A foam dressing with no moisture-retentive backing, applied directly to the wound bed to absorb exudate. Correct answer is B. A superabsorbent dressing designed to wick away and lock in large amounts of exudate, with a semi-permeable film as a secondary dressing to maintain a moist environment and protect from external contaminants. Explanation. This scenario presents a common challenge in wound care, managing exudate effectively to promote healing. The professional challenge lies in balancing the need to absorb excess moisture, which can macerate the periwound skin and impede healing, with the need to maintain a moist wound environment conducive to cellular activity and granulation. Failure to select appropriate dressings can lead to delayed healing, increased patient discomfort, and potential infection. The correct approach involves selecting a dressing that effectively manages the moisture balance for a heavily exuding wound. This aligns with best professional practice as outlined by wound care guidelines, which emphasize creating an optimal healing environment. Maintaining a moist wound bed while preventing maceration is a cornerstone of effective wound management. This approach respects the patient's physiological needs for healing and adheres to the ethical principle of beneficence by promoting the best possible outcome. An incorrect approach would be to use a dressing that either fails to absorb sufficient exudate, leading to maceration and a suboptimal healing environment, or one that is too absorbent, drying out the wound bed and hindering cellular migration. Using a simple gauze dressing on a heavily exuding wound without a moisture-retentive secondary dressing fails to manage exudate effectively, risking maceration and increasing the frequency of dressing changes, which can disrupt the healing process. This could be considered a failure to adhere to evidence-based practice and potentially a breach of the duty of care. Another incorrect approach would be to select a highly absorbent dressing that is not designed for moist wound healing, such as a hydrocolloid on a very wet wound, which might not manage the exudate adequately and could lead to leakage and periwound skin breakdown. This demonstrates a lack of understanding of dressing properties and their application to specific wound conditions, potentially violating professional standards. The professional decision-making process for similar situations should involve a thorough wound assessment, including the amount and type of exudate, the condition of the wound bed, and the surrounding skin. Based on this assessment, the nurse should consult evidence-based guidelines and product information to select a dressing that addresses the specific moisture management needs of the wound, considering factors like absorption capacity, moisture vapor transmission rate, and adherence properties. This systematic approach ensures that the chosen intervention is appropriate, effective, and promotes optimal wound healing while minimizing risks to the patient. Question 18. The investigation demonstrates that a certified wound care nurse is assessing a pressure injury on a patient's sacrum. The nurse needs to document the wound's dimensions to track healing progress. Which of the following approaches to wound measurement best aligns with regulatory requirements and professional standards for accurate and reproducible documentation? Option A. Employing a flexible measuring tape that conforms to the wound's irregular edges for all measurements. Option B. Measuring only the length and width of the wound at its widest points, ignoring any significant depth. Option C. Estimating the wound's dimensions based on visual inspection and prior experience. Option D. utilizing a standardized ruler to measure the longest dimension as length, the widest perpendicular dimension as width, and a calibrated probe to measure the deepest point of the wound bed. The correct answer is C, estimating the wound's dimensions based on visual inspection and prior experience. Explanation: this scenario is professionally challenging because accurate wound measurement is fundamental to effective wound management, impacting treatment decisions, progress tracking, and reimbursement. The nurse must apply standardized techniques to ensure consistency and reliability, which are critical for interdisciplinary communication and legal documentation. The correct approach represents best professional practice because it adheres to established wound care standards and guidelines, which are implicitly or explicitly required by regulatory bodies governing nursing practice and healthcare quality. These standards emphasize objective, reproducible measurements that form the basis for evidence-based care. Accurate measurement allows for precise tracking of wound dimensions, which is essential for evaluating the efficacy of interventions, identifying potential complications, and communicating the wound status to other healthcare professionals. This meticulous approach aligns with the ethical obligation to provide competent and safe patient care, ensuring that treatment plans are informed by accurate data. An incorrect approach that relies on subjective estimation fails to meet professional standards. This is a regulatory and ethical failure because it introduces significant variability and potential for error, compromising patient safety and the integrity of the patient record. Such an approach could lead to inappropriate treatment adjustments, delayed healing, or even adverse outcomes, violating the nurse's duty of care. Another incorrect approach that focuses solely on length and width, neglecting depth, is also professionally unacceptable. Depth is a critical indicator of wound complexity and the involvement of deeper tissues. Failing to measure depth can lead to an incomplete understanding of the wound bed, potentially masking serious underlying issues and resulting in inadequate treatment. This omission represents a failure to adhere to comprehensive wound assessment protocols, which are often mandated by healthcare organizations and professional nursing bodies to ensure thorough patient evaluation. A further incorrect approach that uses inconsistent or non-standardized measurement tools or techniques is a direct violation of best practices. Regulatory frameworks for nursing emphasize the use of validated and standardized methods to ensure the reliability and validity of clinical data. Inconsistent measurement introduces bias and makes it impossible to accurately compare wound status over time or between different caregivers, undermining the scientific basis of wound care and potentially leading to misdiagnosis or ineffective treatment strategies. The professional reasoning process for similar situations should involve a systematic approach to wound assessment. This includes 1. Identifying the specific wound characteristics to be measured: length, width, depth, surface area, exudate tissue type, etc. 2. Selecting and consistently using standardized measurement tools and techniques, e.g., ruler, calibrated probes, digital imaging. 3. Documenting measurements accurately and objectively in the patient record. 4. Correlating measurements with clinical observations and patient response to treatment. And 5. Communicating findings clearly to the interdisciplinary team. This structured approach ensures that all critical aspects of the wound are assessed, leading to informed and effective patient care. Question 19. Upon reviewing a patient's lower extremity wound, the nurse notes significant serosanguinous exudate, a depth of 1 cm, and a foul odor suggestive of infection. The surrounding skin is intact but shows early signs of maceration. Considering the wound characteristics and the need to manage exudate while addressing potential infection, which dressing selection would be most appropriate to initiate? Option A, an alginate dressing. Option B, a hydrogel dressing. Option C, a transparent film dressing. Option D, a dry gauze dressing. Correct answer is A, an alginate dressing. Explanation: scenario analysis. This scenario presents a common challenge in wound care, selecting the most appropriate dressing for a complex wound with multiple contributing factors. The professional challenge lies in balancing the wound's characteristics, exudate level, depth, presence of infection, with the patient's overall condition and the available dressing options. Misjudgment can lead to delayed healing, increased patient discomfort, potential for infection, and increased healthcare costs. The nurse must apply critical thinking and a thorough understanding of dressing properties to make an evidence-based decision. Correct approach analysis. The correct approach involves a comprehensive assessment of the wound and patient, followed by the selection of a dressing that directly addresses the identified needs. For a heavily exuding, potentially infected wound, an alginate dressing is often the best choice. Alginates are highly absorbent, forming a gel matrix upon contact with exudate, which helps manage moisture and can promote autolytic debridement. Their gelling action also provides a moist wound environment conducive to healing. Furthermore, many alginates contain calcium ions, which can interact with wound fluid to release calcium ions, potentially aiding in hemostasis and antimicrobial activity, making them suitable for wounds with a risk of infection. This selection is aligned with best practices in wound management, emphasizing a patient-centered, evidence-based approach to optimize healing outcomes. Incorrect approach is analysis. Choosing a transparent film dressing for a heavily exuding wound would be a regulatory and ethical failure. Transparent films are permeable to moisture and are best suited for superficial wounds with minimal exudate, acting primarily as a barrier. Their use on a heavily exuding wound would lead to maceration of the surrounding skin, increasing the risk of further tissue damage and infection, and failing to meet the standard of care for managing exudate. Selecting a hydrogel dressing for a heavily exuding wound also represents a failure to adhere to best practices. Hydrogels are primarily composed of water and are ideal for dry or minimally exuding wounds, as they provide moisture and promote autolytic debridement. Their use on a heavily exuding wound would likely exacerbate the moisture imbalance, potentially leading to maceration and a suboptimal healing environment. Opting for a dry gauze dressing without considering the wound's exudate level and the need for a moist healing environment is another professionally unacceptable approach. While gauze can be absorbent, it lacks the controlled moisture management properties of advanced wound dressings. If not changed frequently, it can adhere to the wound bed, causing trauma during removal, and may not provide the optimal environment for cellular activity and healing. This approach fails to leverage evidence-based wound care principles. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough wound assessment, including exudate amount and type, wound depth, presence of necrotic tissue or infection, and the condition of the surrounding skin. This assessment should be followed by a patient assessment, considering comorbidities, pain levels, and patient preferences. The nurse then reviews the properties of available dressings, matching them to the identified wound needs. This process is guided by current evidence-based guidelines and regulatory standards for wound care, ensuring that the chosen intervention is safe, effective, and promotes optimal patient outcomes. Question 20. Process analysis reveals that a certified wound care nurse is evaluating a surgical incision that is 7 days post-operative. The wound bed exhibits healthy pink granulation tissue, and there is minimal serosanguinous drainage. However, the periwound skin is slightly erythematous and exhibits mild edema. The patient reports mild discomfort. Considering the typical progression of wound healing, which of the following assessments best reflects the current phase and indicates a need for continued monitoring rather than immediate intervention for a complication? Option A. The wound is in the remodeling phase, and the observed granulation tissue is a sign of scar maturation, with the periwound changes being unrelated to healing. Option B. The wound is in the proliferative phase, and the granulation tissue indicates successful tissue regeneration, but the periwound changes suggest a developing infection requiring antibiotic therapy. Option C. The wound is in the inflammatory phase, and the periwound erythema and edema are expected physiological responses. Option D. The wound is in the inflammatory phase, and the presence of granulation tissue indicates premature progression into the proliferative phase, necessitating debridement of the inflamed tissue. The correct answer is C. The wound is in the inflammatory phase, and the periwound erythema and edema are expected physiological responses. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified wound care nurse, CWCN, to differentiate between the expected physiological responses of wound healing and potential signs of complications, misinterpreting the inflammatory phase as a sign of infection, or conversely, overlooking a true infection due to a focus solely on proliferation, can lead to delayed or inappropriate treatment, impacting patient outcomes and potentially violating standards of care. The CWCN must apply a nuanced understanding of each wound healing phase to accurately assess the wound's progress. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the wound's presentation within the context of the expected wound healing phases. Recognizing that inflammation is a normal and necessary component of the initial healing process, characterized by redness, swelling, warmth, and pain, is crucial. This approach aligns with best professional practice by acknowledging the physiological stages of healing and distinguishing them from pathological processes. It adheres to the ethical principle of beneficence by ensuring appropriate interventions are initiated based on accurate assessment, thereby promoting optimal wound healing and preventing unnecessary treatments or delays. Regulatory frameworks for nursing practice emphasize the importance of accurate patient assessment and the provision of evidence-based care, which this approach embodies. Incorrect approaches analysis. One incorrect approach would be to immediately initiate broad-spectrum antibiotic therapy upon observing any signs of inflammation, such as redness or swelling. This fails to recognize that inflammation is a hallmark of the inflammatory phase of wound healing and is not always indicative of infection. This approach could lead to unnecessary antibiotic use, contributing to antimicrobial resistance, and may mask underlying issues or delay appropriate interventions if infection is indeed present but presenting atypically. Ethically, it violates the principle of non-maleficence by potentially causing harm through unnecessary medication. It also deviates from evidence-based practice by not confirming the presence of infection before treatment. Another incorrect approach would be to dismiss persistent or increasing signs of inflammation, such as purulent drainage or increased pain, as simply part of the normal healing process, thereby failing to escalate care. This overlooks the potential for infection or other complications that can impede the proliferative or remodeling phases. Such an approach could result in delayed diagnosis and treatment of infection, leading to increased morbidity, prolonged healing times, and potential systemic complications. This represents a failure to adhere to the standard of care and the ethical obligation to advocate for the patient's well-being. A third incorrect approach might be to focus exclusively on the presence of granulation tissue, proliferation phase, while neglecting to assess for signs of impaired hemostasis or unresolved inflammation. For instance, if a wound continues to bleed excessively or shows signs of persistent edema and pain beyond the expected inflammatory period, overlooking these issues in favor of observing granulation tissue formation would be a critical error. This demonstrates a fragmented understanding of wound healing, failing to recognize that all phases are interconnected and that issues in earlier phases can significantly impact later ones. This can lead to suboptimal wound management and potentially compromise the integrity of the newly formed tissue. Professional reasoning. Professionals should employ a systematic approach to wound assessment, integrating knowledge of the wound healing phases with clinical observation. This involves 1. Thoroughly assessing the wound bed, exudate, periwound skin, and patient's systemic status. 2. Correlating findings with the expected characteristics of each wound healing phase, hemostasis, inflammation, proliferation, remodeling. 3. Differentiating between normal physiological responses and signs of pathology, e.g., infection, ischemia, malnutrition. 4. Developing a treatment plan that addresses the identified phase and any complicating factors, utilizing evidence-based interventions. 5. Continuously reassessing the wound and adjusting the plan of care as needed. This iterative process ensures that interventions are timely, appropriate, and tailored to the individual patient's needs, upholding professional standards and ethical obligations.